Thank you all for joining us to talk about mental health and breast cancer. Today, I want to bring the hidden traumas of breast cancer into the open and discuss the many ways cancer can sort of chip away at our mental health, from strained relationships to physical pain to overwhelming emotions that we just can't and we shouldn't sweep away. And I want to dig into different options for getting help, because there really are ways to feel better here and there, and then hopefully each day and each night. They may not be a perfect solution for everyone, and it could take time to see the benefits, but it's so important to give yourself a chance to heal through mental health support. While I sit here as the founder and chief medical officer of Breastcancer.org, I'm also someone who's had to cope with life during and after breast cancer treatment. I was diagnosed 13 years ago, and I can tell you that the road to emotional balance can be bumpy. One way or another, breast cancer likes to creep into everyday life, and it's upsetting and exhausting to keep trying to sweep it away. You all have put yourself through so many treatments for your body, and it seems like the attention, though, to your mental health is sadly rare. But there is hope. There are experts who can guide you, and there are communities like the one at Breastcancer.org here to make sure you aren't on this path alone. Whether you're feeling anxious, depressed, resentful, scared, or any other emotion, I hope you leave this webinar with new ideas and information to help you find a better way forward. Now is a good time to stop and give yourself credit for all the hard work that you've done to take care of yourself. And again, now is this time to really heal, recover, and hopefully thrive. Before we welcome our guests, I want to thank our generous sponsor, AstraZeneca, for making our work on mental health possible, including tonight's event. We are honored to be joined by an incredible group of speakers today. Dr. Stephanie Ross is a clinical health psychologist and founder of Illness Navigation Resources. She's also an assistant professor at Northwestern University Feinberg School of Medicine. Dr. Ross specializes in coaching entire families through complex medical decision-making, medical crises, and the aftermath of a medical trauma. We are grateful to have her also as a board member of the Professional Advisory Board of Breastcancer.org. Two of our amazing Breastcancer.org community members, Epiphany and Susanna, will be sharing their stories of finding mental health support while under treatment. Our community director, Melissa Jenkins, will be leading the conversation, and we can't wait to learn from their experiences. Dr. Shelly Latte-Naor is an integrative medicine specialist who is board certified in internal medicine. She is the director of mind-body medicine at Memorial Sloan Kettering Cancer Center. As an expert on complementary therapies, which are used along with conventional treatment, she equips patients with tools to enhance their well-being by using evidence-based approaches, including lifestyle changes, herbs and supplements, acupuncture, yoga, and massage. Her work focuses on finding new ways to use mind-body therapies to increase resilience and enhance quality of life for people living with cancer and cancer survivors. And we're looking forward to closing today's webinar with a meditation session led by Beth Sandweiss. Beth is a psychotherapist with 25 years of experience leading mindfulness meditation workshops and trainings for hospitals, universities, summer camps, and other groups. She regularly works with cancer patients to find calm and inner strength in her role as a mind-body therapist at Memorial Sloan Kettering Cancer Center. Thank you all for being here. Now, they say about 1 in every 4 people diagnosed with cancer experiences depression. And when we shared this stat on our social media channels, we got comments like, really? That's it? And I think it's more than 1 in 4, because the feeling is so prevalent and so overpowering. Depression can visit on and off, or it can move in and refuse to leave. So really, who's actually measuring all of that? My message to you is this: if you are down and depressed, it can be a normal response to all of the hardship that you've been through. And just like any other side effect of cancer, we want you to be able to improve how you're feeling. One aspect of dealing with mental illness that can lead to even more stress is that our family and friends simply may not understand, or we don't want to burden them with our emotions. This can be true at every phase of someone's experience with cancer. What people see on the outside can be drastically different from how we're feeling inside. How many of you can see yourself in one of these photos? And now, whether it's because we're trying to put on a happy face to protect our loved ones, or because they can't relate, or we're hiding behind our struggles beneath the surface, these are the hidden scars many of us live with. Let's talk a little bit about how breast cancer specifically could affect someone in treatment. For starters, breast cancer treatments can contribute to symptoms. Research shows that some chemotherapy drugs can cause side effects like depression, anxiety, and sleep disturbances. Hormonal therapy medicines have side effects that may affect your mood. For example, tamoxifen can push you closer to menopause. The aromatase inhibitors can steal your go-go juice and cause like muscle and joint pain. And all of these changes can affect your mood. Some breast cancer treatments can put you into menopause suddenly, which can be a real emotional roller coaster. Certain types of radiation to the neck area and immunotherapy medicines can affect the thyroid's ability to work properly. And when the thyroid is not active enough, you may feel tired or very blue. This is called hypothyroidism. For many people, having one or both breasts or even part of your breast removed can lead to a lot of complex feelings about your body image, as well as issues with sex and intimacy. And just losing your hair robs so much of you. For young people with breast cancer, there are worries about treatment, interfering with plans to find a partner, get pregnant, and build a family. And relationships can suffer for a variety of reasons. Some loved ones may unknowingly be expressing toxic positivity, which can feel like pressure for you to be extra positive and upbeat just when you want to be yourself, you want to be real about how hard breast cancer is and have those feelings validated. And sadly, some people have loved ones who ghost them, which is when people in our lives disappear or cut off communication without warning. That happened to me with someone I thought was my best friend when I went through breast cancer. It's important to know that you don't have to be officially diagnosed with a mental health condition or disorder to get benefits from mental health services. Can you relate to any of these thoughts? Finding a diagnosis hard to accept, afraid of being sick, anxious about the cancer coming back, angry, stressed, grieving, fearful of dying? If so, you may be someone who can benefit from mental health support. So, should mental health be considered an essential part of cancer care? Well, we think if you need mental health support, then yes, it should be part of your cancer care, your overall wellness. We each deserve a plan that best fits our lives, personalities, and situations. And if your doctor doesn't bring up your mental health, you need to find your voice and ask for support and be your own best advocate for what you need. We have a lot of useful information that you can read before you talk to your doctor. Learn more at Breastcancer.org/mental health. From reframing your thinking to learning coping skills, repairing relationships, building mindfulness, exercising, improving your sleep and overall quality of life, there are so many ways that we can try to manage what we're feeling. And when it comes to mental health support, many people think of a one-on-one therapy session with a counselor, but that experience can vary. Experts may follow a specific approach like behavior therapy, cognitive therapy, and more. We're going to talk with Dr. Ross soon about how to know which form of therapy is best for you at this particular time. Group therapy can provide clarity, ideas to help you, and introduce you to meaningful people and relationships. Our team at Breastcancer.org offers free virtual support groups, which take place every day of the week. You can sign up at Breastcancer.org. We will email you, all of you, with a direct link to today's event, and we hope you'll join us to some of these virtual support groups. Other mental health support options could include antidepressant medications, cannabis for pain, anxiety, or insomnia, and possible other supplements depending on your situation. We'll be hearing soon about complementary therapies like acupuncture, meditation, yoga, lifestyle changes that could alleviate your symptoms. You can also find out more information at breastcancer.org/mental health. Just remember, before you try something that could interfere with your breast cancer treatment, it is important to discuss that with your doctor. If you've decided to work with a therapist but don't know where to start, you could ask your medical team or hospital, go to people you trust for referrals, use your insurance company's database, or look at industry organizations like psychologytoday.com. It can take time to find someone who is the right match for you. The cost of therapy may be intimidating on top of all the other expenses related to breast cancer that you've had to deal with. The first step is to contact your insurance provider to find out exactly what is covered. And if you don't have insurance, speak with a social worker or a financial counselor at the place where you receive treatment. Check out the rules around healthcare providers who are in and out of network, and look into using a flexible spending account or health savings account for fees. Talk with your doctor or hospital about the mental health services that they offer. You can also ask your therapist if they will charge on a sliding scale, meaning that the rate is adjusted based on your income. In a bit, we'll talk more about finding resources that are financially accessible. We received really powerful stories and questions from many of you when you registered for today's event. I want to share 9 words with you that someone wrote because it really gets to the heart of it all. She said, "I want to learn how to be happy again. I want to learn how I can be happy again." Breast cancer can take so much from us. Even when things go right with a treatment, we may need to find our way back to ourselves, and it can take time. But just know that you're not alone in feeling this way, and there is help out there. Before we welcome our first speaker, I want to mention that we have a series of new podcast episodes dedicated to a variety of mental health topics. You can find all of our podcast episodes at breastcancer.org/podcast. Now it's my pleasure to introduce Dr. Stephanie Ross. Dr. Ross is the founder of Illness Navigation Resources and is on the faculty at Northwestern University Feinberg School of Medicine. All the questions we're about to discuss came directly from people attending our webinar today. I want to thank you all for taking the time to share your experiences and your questions. So our first question that you provided, Dr. Ross, many people have pre-existing anxiety that has gotten worse upon a breast cancer diagnosis, or people have new anxiety because of the diagnosis. Where does someone even begin if they're trying to reduce their anxiety?
Well, first, thank you for having me today. I think this is such an important topic, not only because this is my practice area, but because mental health is part of health in general. So once mental health is really part of the getting better and coping process. So in terms of treating anxiety, there are many options out there, but the first part of the question was about pre-existing anxiety. Just because it's anxiety now around a cancer diagnosis doesn't mean that some of the things that may have helped in the past won't help again. So the first thing I always advise people is you don't have to reinvent the wheel. What have you used in the past? What services have you used in the past? Have you used medications? Have you used alternative therapies? What's been helpful to you? And again, if they are complementary therapies and things like that, to check with their physician as to whether that's effective. But cancer-related anxiety is a special case. And anxiety in general results from a loss of control, oftentimes. And at the time of diagnosis, there's a real loss of control of health, control of our future, control of our families, our work. There's so much of that. So we also find ourselves with a lack of planning and ability to plan because we don't know what's coming. So one way to reduce anxiety really is to gather information. And that's gathering information about what your diagnosis is, what the treatment plan will look like, how long it might take, what the side effects may be, what are the considerations to think about for your work situation, your family situation, your childcare situation. What are the things you need to think about? Oftentimes, once a plan is in place for those things, anxiety is naturally reduced. The part about planning, though, is having the knowledge that the plan will never go perfectly. And so having the expectation that despite the fact that your oncologist might give you a treatment plan, will tell you how long it's going to take, that oftentimes there will be an issue, a delay in treatment, a change in the course of treatment, something that has worked that hasn't worked. So being able to anticipate some of those things really does help to reduce anxiety.
You go through treatment, you feel like you've done everything you can to reduce the risk of recurrence, but that fear of recurrence can be nagging. And one person asked, what are the techniques for living in the present and looking forward to the future instead of going down that dark hole and worrying every time I get a new little twinge?
That's a real thing. And, again, information can be super helpful. First of all, it's valid. And oftentimes just validating that, yes, you have now had this diagnosis. You may have had many, many aches and pains in the past that went unnoticed. Headaches, body aches, stomach aches, all sorts of things that you may have been experiencing. But once somebody tells you you have breast cancer, suddenly any symptom that you wake up with is definitely a sign that cancer has recurred. So one way of reducing this is to really ask your provider, what is it that I should be looking for? And this is, cancer treatment has changed. When I was training, oftentimes there were a lot of medical appointments and a lot of scans and frequent evaluations, and patients felt that they didn't have to self-monitor as much. But now a lot of you are self-monitoring. Call us if you have a symptom. And so really being clear with your doctor and your treatment team, what would that symptom look like? So having the knowledge, and how long would it last? When should I call you? And then really understanding, is your treatment team responsive? What's the response time? Am I getting my questions answered? And really considering if that's all right with you. So having those kind of things. Once you've established that not every ache and pain is definitely a recurrence, then we can use some of the techniques, such as using cognitive behavioral therapy techniques, where we can ask someone, what's another alternate explanation for the symptom you're having? It's that ability to pause and really think about it before jumping to the conclusion that this is definitely a recurrence. And therapy and learning those techniques can really help patients to pause. So can some of the psychotropic medications can really aid in that.
So do you have any tips, ready to use tips to how to put things in perspective, sort of shift your thinking and put yourself in a little bit more of a positive mindset and as a way to cope with all this, rather than keep finding yourself plunging down into that dark hole, keeping your head high and, looking forward to the day and to the next day, et cetera.
So, we hear about positive mindset, growth mindset. And the first thing I just want to mention is that a lot of patients feel a lot of pressure to be positive every day, every minute of every day, and really feel that if they're not positive in some way, that they're going to negatively impact their prognosis. So first off, cancer or no cancer, not everyone feels positive every day and all day in general. So take the pressure off of yourself. We're a society, we're a culture where everything's about what's the silver lining? What did you learn from this? And lots of patients I have had the privilege of treating over the years have said there really was no silver lining, and that's okay. We don't have to look for those things. When, that being said, when we feel so negative that we are not assisting in our own getting better, that's when it's time to seek professional help. So while you don't have to be, greeting the day every day while you're going through a grueling treatment, if you do find yourself not being compliant with recommendations to take medication, you're missing your appointments, you are feeling really depressed to the point that you're not doing anything to aid in your recovery, then that's an issue.
There are all these expectations that people have a view that they, we hold up the world, like between, our home, work, or the community, and everyone's like waiting for us to get back to normal. And then they expect it, and then we expect it of ourselves. So we end up feeling disappointed a lot and feeling less than. It contributes to that feeling of being down and out. Someone asked from the community about sort of some of the extreme physical changes that can lead to depression, and how do I deal with accepting my new body, feeling betrayed by my body, and dealing with the limitations on being active due to like pain, discomfort, or just lack of flexibility.
First of all, again, to validate that that's normal. We expect our bodies to perform. Nobody wakes up every day and expects that their body is going to fail them in some way. And we take it very personally when that happens. And one of the ways to help yourself through this is not just to think in terms of disability. Oftentimes, it's a list of things I can't do anymore, or I can't wear anymore, or I can't own anymore. And we forget about the things that you still can do. So finding ways that you can adapt at everyday activities, whether you need to sit down while you're cooking, or whether you need to walk instead of run, and giving up on the notion. I think that a lot of what we see in books and magazines and on television are people who were diagnosed with breast cancer and then ran a marathon the next week. We don't see what's real, which is right. The people who aren't doing that. And so finding the things that you still can do and how you can still be present and adapt your exercise, adapting your travel, all of those things around what you still can do.
Right. And thanking your body for what it can do, like just going to the bathroom.
Yeah, huge.
My body was able to do that. Breathing, like that. My lungs, my heart, they're working. My fingers, a lot of people have problems with like peripheral neuropathy, but there's still things that you can do, that you can feel, but there are ways of sort of like building back the love that you lost through that betrayal.
But there is a grieving there. And I think that,
there's a grieving there.
This whole societal expectation that, bald is beautiful, you have an amazing head, you look great.
Right. All that positive toxicity, which is, all the time, everyone wants you, they want you to be better, and they sort of impose that on you, and they expect you, and that just can wear you down even more.
Sure.
What about how do you help people deal with the regret over treatment decisions? Like, I did that, but I should have done that, or I did this, someone else told me it was too late when they told me to do that, or whatever. How do you sort of handle those things?
I think it comes up all the time, first of all, especially with, the massive amounts of information that we have access to now through the internet and other resources. It used to be that you did what was prescribed for you and you didn't think much about it beyond having maybe a relative or a well-meaning friend tell you, maybe that you should have gone somewhere else. So, really learning to accept that we made the treatment decisions we made with the best knowledge we had available at the time.
Yes.
And really accepting that. There's sort of a newer therapy called acceptance and commitment therapy that can help to integrate some of that thinking for ourselves, but also taking that regret and learning what can we do better next time.
Right.
A lot of people think that the treatment course they set off on right at the beginning they have to stay that course the rest of the way. And, there is often times to get more care, different care, another opinion, another way. So while we can't change the past, we may be able to change the present, and we may be able to forgive ourselves.
Right. Don't want to dig too deep in the past, but you definitely want to learn from it and try to get some forward momentum. And I know for myself, I've had to, too much time to really rethink all the decisions. And I just have to say, I made the best decision I could at the time with the information that I had.
Mm-hmm.
And then every day, actually, there's an opportunity to take care of yourself. I'm going to do the best I can today to be as healthy as possible. And no one's perfect, right?
Definitely.
Yes. Yeah. So many people in our community are living with metastatic breast cancer. And I want to acknowledge the distinct mental health issues that they are dealing with. Can you touch on what people with stage 4 breast cancer should know about finding support?
Really finding the right support and finding someone who can go there with you in a meaningful way. Metastatic breast cancer can be incredibly isolating. It's very scary, and it can be different. It's different for everyone. Everyone's experience is uniquely theirs, but really finding whether it's a therapist, a support group, where people are able to go to the place that might be scary for other people. In the beginning, when Breastcancer.org got started and when I began my training, there was like one breast cancer support group for everyone. Everyone with breast cancer, no matter what age or stage, is welcome and come. And what we really learned was that, early stage breast cancer is really different than metastatic cancer. I've learned so much from my patients, and with her permission, one of the patients I was speaking with today, who is young and has metastatic breast cancer, really wrote a note to many of her friends and family on her Caring Bridge, talking about death and saying that she's okay talking about that, and that's a reality, and gave some really useful tips on how people could talk to her or choose not to talk to her about that. But really, the acknowledgement that this could be a life-limiting illness really distinguishes it. And it's really important to find the support and the people and the places where you are able to be your authentic self and really talk about those things while preserving hope.
We received great questions about how to start working with a therapist. For one, do you think it's important to select a therapist who has experience specifically helping people with breast cancer? And two, how do you know the right type of therapy to try?
So you don't have to know everything. Some of it is trial and error. In terms of a therapist who has breast cancer experience or any cancer experience, sometimes it's really helpful so that you don't find yourself teaching them the medical. They have some knowledge of what the process is. And like you were talking about, Marisa, at the beginning about the side effects of some of the treatments. And so not having to come in cold and sit with your provider and tell them, well, this is what I'm going through, and have them, misattribute it to something else. So if you can find someone who has some oncology experience, it can be helpful. That being said, sometimes depression is depression, and anxiety is anxiety. And so finding someone with whom you have a good rapport, stylistically, we're all really different and our training is different. And this is an important relationship. So it's okay to have a consultation with the right person, and a good experienced therapist isn't going to be really offended if you call them back and say, this wasn't the right fit for me. Again, if you've had therapy in the past and you know what you like and didn't like, if you are somebody who wants tips and workbooks and strategies, you may be looking more for someone who has more of a behavioral bent than an analytic kind of training. But really, speaking openly about what you're looking for when you sort of interview this person.
Do you have tips for how you can get the most out of your therapy sessions? Like you've got so much you want to accomplish, but it's a short amount of time. Like, how do you get the most out of those sessions?
So, the real work goes on between sessions, not in the sessions, because oftentimes it's 45 to 55 minutes and you walk out of there and all sorts of things then happen in the interval time. So really, to get the most benefit, I really am a big fan of setting goals at the beginning with your therapist, and these goals can change. But if at the beginning you can sit down and say, these are the 3 things that I'm struggling with, these are 3 things I want to work on, and maybe then asking the therapist, what are your goals for me? How do you see this working out?
Yeah.
Keeping some notes in between sessions. So what happens, what triggers you during the week, what made you think, we all think, oh, I'm going to remember that and talk about it in my therapy session. Nobody remembers it. So
It could
using
be as
the,
simple and practical as like one person asked a question about like, how do I get so stuck worrying about every product I use and every ingredient in the food, personal care products, clothing, that, and it just, it's hard to move forward when you get stuck trying to make these decisions that feel big when like there are many small ones like that in your everyday.
yeah. So, I see patients all the time who are terrified because, again, we want to have control over something that happened to our bodies that probably was beyond our control, at least that we know about in terms of environmental influences. So I'm a really big fan of moderation and doing the best you can. That if your fear of products and the environment and everything around you is so great that it's causing you not to do the things that you used to like to do, then how is that impacting your quality of life?
Can just steal your pleasure, your joy from, like, you don't enjoy eating anymore. That would be terrible.
It is
Yeah.
terrible. And people really feel that if they eat this one thing, that, it's going to make the cancer come back. And I really wish we knew that. I'm sure you as,
Right. Well, I agree in moderation. And, we do have a lot of information on Breastcancer.org about the best diet and how best to keep physically active and how to look at what goes in, on, and around you to make sure you are selecting the best products possible, given the situation. And I just want to follow up on, on the therapy in terms of the cost of care. And that the cost of therapy can stop people from seeking help. And what do you suggest for people who want support but can't afford a high out-of-pocket cost?
I think, there are several organizations that actually have grants that will provide money for cancer patients to seek mental health services. So really doing some digging and asking the social workers. They often have tons of information where you're being treated. Looking to many communities, I know where we live in Chicago have nonprofit cancer support centers. There are online resources to help that often provide free or low cost services. Looking to training clinics also, if there are counseling programs and universities in your area, sometimes can provide low or free services to patients, but really ask where you're being treated.
Yes. And there are funds that may be available in your hospital that someone donated just for this purpose. What do you think of the meditation or the counseling apps that people can download?
There's a lot out there. And in terms of in the digital health space is what we call it. I think as an adjunct to therapy, not everyone needs talk therapy. Not everyone needs weekly sessions. Sometimes there are some fantastic apps out there that really can help with breathing. Breathing is huge. Can help with insomnia, can help with anxiety, all of those things. So I am a really big fan of many of the apps. I like Headspace, I like Calm, I like Insight Timer. They can help with sleep. They can help with all sorts of things. There are also symptom tracking apps. In terms of digital therapy, it's a little harder to know. It's a newer area, and there's high turnover in that space. So a lot of patients really want someone who's going to be able to stick with them. If you are choosing, a digital platform to to know a little bit about how it all works, how long that you can expect the person to be around. You know, the thing about therapy during breast cancer is that it can be before, during, and after, and after. Not everyone has anxiety when they get the diagnosis, nor the time or the headspace, the mental capacity to deal with it then. And it can come out years later. And so knowing that someone is, you know, sort of in the community, or there's a resource in your community that's may still be there many years later when something comes up, I think it's really useful.
It's amazing at the Breastcancer.org community, how many people have, you know, got help themselves and then have stuck around and are helping everybody else. And it's just a beautiful thing, because women want to help themselves, but they also want to help everyone else overcome their situation. Thank you so much, Dr. Ross. We really appreciate all the valuable information that you shared today. And if anyone has any questions for Dr. Ross, you can ask using the Q&A button on the bottom of your screens.
Thank you.
Thank you. Now I'm excited to welcome our community director, Melissa Jenkins, who leads our free virtual support groups and the recently redesigned online discussion forums, which you can register for at no cost on Breastcancer.org. Melissa is being joined by Epiphany and Susanna, two very inspiring members of our community who will talk about their experiences with breast cancer and finding mental health support.
Thank you, Dr. Weiss, and welcome, Susanna and Epiphany. It's so great to have you here tonight. I have had the privilege of getting to know you over the last year, but I want to hear, you've been so supportive of others and of each other and gained support in our groups. We want to know, can you share with us how breast cancer has affected your mental health and what you've done to help manage those uncomfortable feelings or those feelings of anxiety, depression, stress, whatever it might be for you that has come up?
Thank you for having me. How cancer affected my mental health was it really gave me the scariest week of my entire life. The hardest part of my cancer journey really was that first week of when I was not getting diagnosed yet. And it was because I felt alone and I felt scared. And even though friends and family tried to comfort me, they'd say the wrong things. Like Dr. Ross said, Dr. Weiss said, that toxic positivity, it was very scary. So how I helped kind of manage that was, once I was diagnosed, I actually came across your wonderful weekly Zoom, Breastcancer.org Zoom calls. And I found a community that had strong women who were going through the exact same things that I was going through. And I felt that I wasn't alone anymore. And yes, I would still be scared, but I no longer was alone. So the next time I was in a moment, radiation, next time that came up, I was literally on the slab saying, okay, if Jody can do this, I can do this. If Jody can do this, I can do this. And that's a fellow attendee of the weekly meeting. So I had someone in there with me, and it was just very comforting. So I'm still afraid, but it still helped.
Yeah, I think for me, the mental health part it changes over the course. I think from the beginning of getting the diagnosis, you know, I had those feelings of freaking out. I was scared. I was alone. I was one of the first people within my circle to have breast cancer. So I was just trying to navigate what to do. But then I think both Dr. Weiss and Dr. Ross talked about, I was so focused in on the treatment that I didn't really focus so much on anxiety and some of these other factors that were happening. But it really hit me this last couple of weeks. I finished my last treatment 2 months ago. And then I finally had that space to really sit and think and reflect of what just happened. And it was really scary for me to really realize that what happened was very serious. I think I did try to minimize it. And I think that was really helpful for me while I was going through treatment. But I think now I had this chance to really sit back and say, wow, well, this is now a part of my life. And how am I going to live with this cancer? So I think that was one thing. I think the other thing that it really made me focus on my mental health. I think it was one of those things where I just never really considered it that much. I've always considered myself as a pretty easygoing person. Things don't really bother me too much. But I think having a breast cancer diagnosis forced me to prioritize me. Like, I'm also one of these types of people, I put everybody else first. I'm always the one that I'm helping everybody else. And this was a time when I needed help. And that was really hard, but I made sure that, there's certain things that were just not negotiable in my day. One was my runs, which then turned into my walks, which then turned into indoor bike rides because I had to keep changing because my body was not allowing me to do certain things. Now I'm back to running again. That, and then number 2 was going to the Zoom support groups on Tuesday, where I met Melissa and I met Epiphany. And I think one moment that, Epiphany, you just reminded me of your moment with Jody. For me, my moment, it was the first time that I joined the group, and I had just had my first chemo and I had very long hair. And a couple days I was planning on getting my head shaved to get ready for losing all of my hair. And I was really, really scared. And I remember looking at Epiphany and another woman, Pamela, and they both had really short, total rock star haircuts. And they're like, you can do this, you're gonna look amazing. And it was just that push that I needed to give me that confidence, because I tell you, losing my hair was the hardest part of going through breast cancer treatment. And I feel so lucky that I have Epiphany and Pamela and the rest of the Breastcancer.org community as part of my story that's really helped me and given me strength.
I so appreciate you both, and for representing the group at large and encouraging others to come to receive the support. So thanks.
Well, thank you so much to Epiphany and Susanna for sharing your stories and shining a light on mental health and breast cancer. You made it so real, and people can just feel your journey, and it's very inspiring. We're so grateful to have you as part of our community. And thank you so much to Melissa for leading the discussion and leading all these amazing meetups, these support groups that we provide at Breastcancer.org. Now I'm thrilled to introduce Dr. Shelly Latte-Naor. She is the Director of Mind-Body Medicine at Memorial Sloan Kettering Cancer Center. Welcome, Dr. Naor.
Thank you for having me.
Oh, well, thank you for coming. We have a lot of questions here from people who are attending this program tonight. Let's start with sort of an overview on the types of mind-body therapies and how they're used in combination with conventional treatments.
Yeah, so there are many definitions of mind-body therapies. One of my favorite definitions declares mind-body therapies as approaches that recognize the effect of thought, feeling, and belief on health, as well as the impact of health and illness on attitude and thought. So these are modalities that work on the intersection of behavioral and emotional wellness, as well as physical and symptom management, physical health and symptom management. So, and when we're thinking about mind-body therapies, the classic ones are meditation and meditative practices such as mindfulness-based practices, and then also the meditative movement practices, including yoga, tai chi, qigong, hypnosis, and some people would count forms of CBT, like cognitive behavioral therapy for insomnia, which we often do with patients, as mind-body practices. I also would count some of the provider-dependent treatments, such as acupuncture and massage therapy, in that category. So you're seeing it's a broad collection of very diverse modalities with a broad application in the cancer setting. You know, in contrast to other complementary treatments, these are modalities that have little to no contraindications or adverse effects. And so they have many applications for symptom management and supportive care.
You know, I've always said, and I'm sure you've heard yourself say this, that your mind is your strongest, biggest organ, you know, and so many times our mind takes us down that dark rabbit hole, but we can actually sort of redirect and use the power of our mind to get us to develop more insights, to have more joy, to find more meaning, to get us to a healthier place, to sort of to practice new ways of thinking and doing things that will make life better. And few of us have had any formal training in mindfulness, and sometimes it takes an experience like breast cancer get us on that path. Can you explain further how these therapies may help people with cancer, both physically and emotionally? Like, where are the data on this? Like, I know there's proof, but tell us what you know about that.
So the best summary of the data is probably, we can probably find in the treatment guidelines that were put out by the Society for Integrative Oncology. These were updated a couple of years ago, I want to say 2 or 3 years ago, and were widely endorsed by ASCO, which is the American Society for Clinical Oncology. So they contain the best available evidence of how to use complementary treatments in the breast cancer setting. And interestingly, from all complementary treatments, mind-body therapies have been endorsed with the highest level of evidence across different indications. And the best established indications are related to improving quality of life, improving fatigue, improving sleep or treating insomnia, of course, addressing stress, psychological distress, and also depression, symptoms of depression, especially secondary depression prevention, which means avoiding depression recurrence, as well as treating anxiety. So, there's been a prominent randomized controlled trial that was published last year, published in JAMA, which is a leading medical journal, that looked at a randomized controlled trial comparing mindfulness-based stress reduction, with a standard treatment of anxiety disorders called Lexapro, a widely prescribed medication. And MBSR, mindfulness, has been found to be non-inferior to this widespread medical treatment for anxiety. So really putting some of these mindfulness and mind-body therapies as adjunct options to be used alongside some of the conventional treatments to address some of these symptoms. In terms of physical symptoms, there are many applications, including chronic pain, and then things like fibromyalgia, IBS, menopausal hot flashes, possibly effective for treating insomnia, sexual changes in the context of breast cancer survivorship. There's good evidence to support mindfulness-based practices and other mind-body therapies for these things. But I usually like to zoom out from these individual symptoms and like to look at symptom complexes. Right? Often symptoms don't come alone, right? Often symptoms are attached to other symptoms. A good example of that is the menopausal symptom complex, right? Where hot flashes come alongside sleep disturbance and musculoskeletal pain and mood changes, right? And so we know that changing one of these symptoms can often have a ripple effect on overall well-being. And because mind-body practices are, have such a wide application with evidence that really documents its effect across different symptoms, it's great at addressing these symptom complexes, especially because there's few contraindications, right?
I think of it like a gang. Like you get attacked by anxiety, and then you get depressed about it, and you get frustrated, and then you feel more alone and isolated, and then you feel pity for yourself. Yeah. I mean, I remember going through breast cancer. I've had a number of private pity parties that I needed to have, because I had losses and, things had changed and relationships had changed. It was just too much going on at once. And that's why I think that, I think of it as like a gang, but it's certainly complex. Do you have any suggestions for how to reduce like scanxiety? That's the anxiety people may feel before they have scans, checking for cancer, just what's going on, for if there's any spread or any recurrence or anything like that.
One of the things that I observe in my patients is that many patients turn to mind-body practices at the peak of their stress, right? The days before the next scan or the doctor's visit. And that's where they go to the app and listen to the guided meditation. And that's great. I love these resources. These are wonderful, and it's a good use of these practices, but it's not the best use of these practices. And that's because using these tools, using mind-body therapies to address an acute stressor is a little bit like going in and trying to brush away a cavity, right? It's much better to use these modalities on an ongoing basis to build resilience towards stressors. right? Some of these modalities like mindfulness-based stress reduction, it says stress reduction, but in reality, most of us can't reduce any of our stressors. We can't turn them down, we can't delete them. Most of the things that I've been stressed about today, I'll have to face, tomorrow again. And in the cancer setting, that's true for, follow-up scans and, recurrent peak stressors that will come on, every now and then. And so providing our patients with tools, with practices that help them to meet stressors in a way that doesn't affect them negatively as much is very empowering, right? I think Dr. Ross spoke about anxiety being triggered by that loss of control. So having a modality that you can use yourself, it's a skill that you own, is very empowering, right? And it's a skill that helps us metabolize some of these unavoidable stressors in a different way. So a regular use of mind body practices is helpful, but I often teach patients what I call the DICE acronym, which is distraction, indulgence, so things that give you joy, finding calm, and that doesn't have to be meditation, it can be just taking a bath, and expression, so sharing either with somebody else or emotional detox on paper, expressive writing, for example.
And your research has shown that managing stress in these ways can actually improve your outcome.
So, I'm very careful with mind body practices in relation to outcome. There's no good evidence that says that we can, meditate certain symptoms away or improve cancer outcomes with mind body practices. It's more indirectly, right? So as we can improve our resilience towards treatment and our resilience towards recovery, reduce some of our symptoms, manage them better, we might be more prone to completing treatment without interruptions, right? But there is no good research that really shows reducing stress can improve outcomes. And I don't think it's helpful to think about it this way, because in reality, a cancer diagnosis is one of the most stressful things that can occur. The last thing I want for my patients is to be stressed about the stress, right? On the contrary, I want my patients to feel like psychologically they have the makeup to deal with stress, and we give them additional tools to confront stress, right? Stress is such a triggering word as well, such an interesting area here, because many patients have the suspicion that their cancer is related or caused by a stressful event or a stressful period in their lives.
Right. It becomes a burden in that way.
Exactly.
Those tools are so helpful. And what I've heard is one therapist say, Shauna Shapiro would say, and I'm sure this has been a very famous piece of advice, which is that what you practice gets stronger. So for example, if you practice being hurt and upset because the person you thought would be nice to you is sort of being dismissive, and that's always your reaction. First of all, it's very upsetting when someone is dismissive to you, but that reaction will get stronger and stronger because you practice it all the time. But if we can sort of learn a different pathway in and keep practicing that, and that'll get stronger too. Like the better things can get stronger. You can use your mind in new ways, but these are practices. These are tools that you need to learn how to use, and practicing helps you get better at it. When I went through breast cancer 13 years ago, my husband, who had married a very independent woman, was not used to the dependent person. I was like, I was pissed. I was really pissed, but I sort of like changed my runway a little bit, and he became more responsive to that. And so it ended up being a good thing, but it was a tool I had to learn how to do, and not something that I had done before. And I, continue to practice it, and I continue to do it today, but I really do believe that that's true. Someone asked a question on a different topic, which is like the brain fog and the difficulty sort of focusing. And this person tried exercise and rest, which didn't really help them very much. So what can they do to combat those challenges?
Brain fog is such a common complaint, especially in the breast cancer population, because many are really embedded in their lives, right? They're engaged in childcare, elder care, in their profession. So even small changes in cognitive functions are something that people feel. While there is no, established treatment guideline, right? Not a medication that can be prescribed. There are some mind body therapies that have some emerging evidence of being helpful in the setting of cognitive changes in the breast cancer setting. So, for example, there was a systematic review that was published in 2018 looking at mindfulness-based practices for cognitive changes among breast cancer survivors. The results were not entirely conclusive, right? They looked at 6 different studies. 2 didn't really show a relationship between mindfulness-based practices and improvement in cognitive function. 2 studies did show an improvement, but it wasn't really long-lasting. And then 2 studies showed an improvement of cognitive function with mindfulness-based practices that lasted for 2 to 6 months. So it's difficult. So the jury is still out. There's also evidence around yoga-based practices improving vitality, physical functioning, measures of fatigue, and decreasing some inflammatory markers, also a very prominent publication. So, the jury is still out, but again, I would encourage people to, again, think about brain fog as a symptom complex, because brain fog seldomly comes alone. Clinically, I find that many patients also complain about changes in their sleep quality, changes in their mood, other physical symptoms that may eat away at their capacity to concentrate. And so while there is not a really good treatment for brain fog, there might be different modalities that might be helpful. There are good treatments to address insomnia and sleep disturbance. There are good treatments that can improve stress management, and these have an unquestionable effect on cognitive function. Also, we are currently enrolling breast cancer patient in a study that we call the ENHANCE study. And my colleague Kevin Liu is the principal investigator, and that evaluates a acupuncture intervention for cognitive changes in breast cancer patients.
Right. And just from a practical daily safety point of view, if you're really not feeling, focused and able to sort of manage, maybe you also have problems with walking, and fine motor things, your balance might be off, safety is key. And we might have to do a little less of the multitasking that we've been doing all our lives, and do it more like a man, where they just do kind of one thing at a time. Don't ever, for example, turn on the hot water, the kettle, and go upstairs and just get that one thing, because you might find yourself stuck upstairs and forget that you did it. So, I really had to sort of, recovering from, my own experience and for taking care of people with breast cancer, really trying to make sure that people, build back their confidence and their ability to do what they need to do, want to do on a daily basis. Let's talk about
making lists and very deliberate time management is very helpful in this setting.
Yeah. And cognitive therapy can be so helpful, can build back your confidence. Like, you get either certain things, your tasks that you'll do during the week, or people you'll meet with. And once you do that, you feel better and able to do it again and build on that. Let's talk about disparities in care and what people can do if their needs aren't being heard. Here's a question we received. Health equity is an issue for Black women. Our request for help with mental health is often downplayed or totally ignored. What can we do if that happens?
So, health inequality and health disparities are not limited to mental health. It's an unacceptable reality across the healthcare system. And I see it, for example, in menopausal symptoms or other symptoms that are just, not being adequately addressed. And we see that in our statistics, in our outcome statistics regarding maternal health and other health outcomes. So this is a huge topic, right? Health inequalities and systemic racism in the medical system. So, one of the things that I would advise is to find independent resources, right? So to find places like Breastcancer.org has such fantastic resources. Looking to self-advocate. Many of the patients that see me are self-referred. They're not, waiting for the provider to refer them. They are self-referred. Many seek second opinions in order to improve the confidence in their care and to establish a bigger network of resources. Locally, many providers can refer you to low-cost, very accessible things like here in New York City, there's the Red Door community, there's Mary's Place nearby, there's Cancer.org, and many places where patients can find resources for accessible mental health. But again, as I'm saying this, you're noticing that I'm putting the onus here on the patient, right? The patient has to find a second opinion, to seek out resources and to advocate. That's really unacceptable, and that's really on us to improve the mental health landscape in this way. In integrative medicine, this is a central challenge, right? Many of the modalities that we offer are not covered by insurance. And so it's our mission to generate the evidence to make some of these evidence-supported treatment the standard of care in cancer treatment, and to make it insurance covered and eventually. So in the meantime, many of our trials are focused in accruing a diverse patient population, make through the trials many of these treatments accessible as possible.
Thank you. That's really important. And I know that every hospital has different resources, and there are people who work there that you may never have met that have so much knowledge about what's out there, that they've done it for other people, they want to help you with it. And I know at my hospital I have patients who've given money to help people get access to complementary medicines, or get Lyft rides or Uber rides, or to cover this, that, and the other. So you kind of have to, even when you're feeling kind of down and out and maybe isolated and lonely, which has been a huge issue during the pandemic, you kind of have to find that inner voice and sort of speak up and advocate for yourself, because it's how you're going to get to a better place. What do you recommend for people who want to try an integrative medicine approach, but their doctor or hospital doesn't have or offer complementary therapies? Can they find free resources online? And what safety issues or drug interactions should they be aware of?
Yeah, so some of the resources that we have on our website are a good place to start. We have something we call the meditation station. This is our mind-body therapists have recorded different practices, including music therapy pieces, guided imagery, mindfulness meditations, meditative practices from the yoga tradition that are just living freely on our website and are accessible to all. We also have a website that is called About Herbs. So if you were to Google Memorial Sloan Kettering About Herbs, you would find a data bank that is also freely available. It's also an app where you can learn more about research about natural products. You can also learn about potential interactions. A good resource for you is if your provider is not as knowledgeable, is to speak to a pharmacist. So I often refer patients that live somewhere where there's no complementary medicine expertise to have the pharmacist look for herb-drug interactions, for example. That's a good first step. But of course, I have to caution about the use of natural products that are unsupervised. We see a lot of problems with that, especially when it comes to unwanted toxicities, possible estrogenic effects through plants, and of course, herb-drug interactions.
We think about herbs as like something you put in our food that we can have. It's available here and there. But actually, when you take certain products, particularly if they're concentrated, pharmaceutical products, I mean, those are medications. They have drug effects.
Yeah.
That's a lot of our medicines that are in the pharmacy actually came from herbs.
Yeah.
Like Taxol was originally, came off of the bark of a Pacific yew tree, I think it
Yes.
is. Aspirin comes from an herb. I mean, so we do need to be sure that what we're doing is safe as well as effective.
Absolutely. There's really, we see it as sort of dichotomous. This is natural, this is pharmaceutical. Right. But for me, this is a continuum, and natural products often work on the same receptors as some of our prescription medications, and they can have the same toxicities and adverse effects as well. So it's also very important to be detailed about using of herbal products. You want to make sure it's the right plant, the right part of the plant, the right extraction, the right dose, is it standardized or not?
Exactly. I just did a study looking at cannabidiol in the treatment of peripheral neuropathy in patients who'd had numbness, tingling, pain in their hands and their feet compared to placebo. But it's a medicine, and cannabis is being studied more to learn more of its value beyond what's been shown in terms of pain, anxiety, insomnia, and appetite, things like nausea, things like that. Well, thank you so much, Dr. Latte.
My pleasure.
Naor, for providing so many helpful and important insights about using complementary therapies in combination with conventional medicines, and just to hear you, how committed you are to the care of your patients, the empathy that we can feel. I know that everyone really appreciates that. Thank you so much.
Pleasure.
Now it's my pleasure to introduce Beth Sandweiss, a mind-body therapist at Memorial Sloan Kettering Cancer Center, who will lead us in a meditation that addresses many of the feelings we've talked about today. Thank you so much, Beth, for joining us. And Beth, you have the privilege and the honor and mindfulness to conclude this amazing program, and which is a resource to so many who really need it, and we're all grateful to you. So thank you, Beth.
Thank you so much. I have been sitting here listening and am so moved by both the questions, the presentations, and actually the common humanity that I'm seeing here. And one of the things I do at Memorial Sloan Kettering is I participate in something, I lead meditation at something called I Am at Home. And we will give you resources so you can find, I'm seeing questions also about resources, how to find meditation station, how you can participate in meditation. I Am at Home is one of those that we do online. So for this finale here, I heard Dr. Stephanie Ross speak a lot about validation. And so what I'd like to do at this moment is take a moment, and we're going to practice something called stop, which is stop, take a breath, observe, and perceive. Okay, so here we'll stop first, take an intentional pause right now, and just for a moment, as you're pausing, see if you've been sitting for a very long time. So maybe move your body in any way that might feel comfortable for you right now. Or if you prefer, sitting and allowing the weight of your body really to rest in the chair underneath you, so that you kind of let gravity do its thing and you feel the support that's underneath you. And feel the way perhaps that your body is taking in the support of the chair, the cushion, even feeling the back of the chair supporting your back body and your feet on the ground. Sometimes when we deal with anxiety, as we've heard here, that we're anticipating and guessing and worrying about what's going to happen in the next moment. How will I deal with it? Will I be able to deal with it? Maybe there's something wrong. So I want to stop and I want to feel something that's real right now, that's real and concrete and right here, right now. The chair, the floor, the feeling perhaps of my hands together. Something concrete to anchor my attention right here. So I stop and I do that. T. Let's take an intentional breath. Okay, so let's breathe together in through your nostrils, all the way in. And you can breathe all the way out. Breathe out through your mouth at first. Let's extend the exhalation. Breathe out. You can even let out a sigh. Ooh. Let's do that again, taking a breath in, breathing in. All the way in and breathing out. Let's extend the exhalation. And one more time, and this time as I breathe in, breathe out, releasing to the extent possible any tension that's in your body and your mind to the best of your ability. And then let your attention and let your body and let your breath now rest in its natural rhythm. So stop, we're going to stop and connect, right? Stop and ground. We're going to T, take a breath, take an intentional breath or 2 or 3. Those are all the T's. A breath or 2 or 3. And then O, observe. And what are we observing actually? We're checking, moving our attention inward and seeing what sensations are present. In other words, what am I feeling right now physically? Am I tired? Is there heat? Is there coolness? Is there discomfort? Is there any part of my experience or body that feels at ease? Maybe that too. So physical sensations, also emotions. You might check and ask yourself, what am I experiencing? Right? Am I happy? Am I excited? Sad? Am I feeling lonely? Am I feeling worried? Am I feeling peaceful? So we're checking in, and thoughts. What are my thoughts doing now? Am I thinking about what's next? Am I thinking about dinner? Am I thinking about any kind of random thought that's on my mind? Okay, so I'm going to check in with myself. And the reason for this is I want to validate what is here for me right now. I'm not fighting it, not pushing it away, but what's right here for me right now. And sometimes too, it's said that if we name what's here, we name our emotions, we can tame them, right? To avoid them, push away, distract are some possibilities. But in meditation, we kind of rest with what is here right now. And also to know that as long as we're breathing and sitting here at this moment right now, there is more right with us than wrong with us. Whatever might be happening in the next moment or 5 minutes from now or tomorrow. So I'm going to observe and welcome what's here to the extent possible. Now for the P, this is proceed. What I'd like to do for our proceed here is to bring some kind of warmth and compassion to our experience. So compassion has 2 sides to it. There's a tender side of compassion and a fierce side of compassion. So what I would like to do is ask myself, and you can do this for yourself right now, you might, if you feel like it, put a hand or 2 on your heart. Sometimes I like to do this as a butterfly. You can say, I put out my hands and cross the fingers here and maybe even gently tap. Sometimes this can be really calming. Sometimes it can be calming to do this. If that's not feeling good for you or possible for you, do it. And then I might ask myself here, what do I need right now? What do I need right now at this moment? And the answer might be that I need some tenderness, I need some comfort. And if that's the case, I might ask myself, what would I say to my best friend if they were struggling in the way that I'm struggling right now? And say that to myself. Sometimes it's so hard to give ourselves the messages that we know how to give others compassionately. So I might say, I'm here with you. I'm right here. It's okay to feel this way. I care. Maybe I need some fierce self-compassion, some cheerleading, like you can do it, you got this. So what do I need now? Maybe I just need to offer myself kind of supportive touch. A lot of evidence that supportive touch, that when we touch and offer touch to others, it helps them to regulate their nervous systems and to calm down. And there's that part within us that is also always receptive, to touch and maybe our own touch. I'm going to begin to offer myself some things that might help me. So breathing, Breathing in and out, anchoring my attention in this present moment right here. The breath is happening now, not tomorrow, not yesterday. Touch, which would ground myself in something physical. Words that might be helpful, whether they're words that are tender and comforting or words that are emboldening, and both are forms of self-compassion. And then I want to do finally just a little bit of a shower of compassion from the head all the way down, just kind of starting with the top of my head, moving down to my eyes, relaxing my eyes, relaxing my cheeks and my jaw, moving down your neck, down the shoulders, down the arms, into your hands, and the front and the back of the body, and hips, and legs and feet, sensing your whole body present right here, right now. Let's take another breath in together. And a breath out. And then just reflect for a moment on the most useful, best parts of this evening together. Maybe something that you want to take away from this evening. And any part of your experience that feels good to have been together with other people. Any relief from hearing different experts speaking, the common humanity of all of us here. Just to the best of our ability, just to savor that. And then on behalf of Breastcancer.org, we all want to thank you for joining us this evening. And I know that recording is available for everybody. So have a wonderful night, a good sleep, and take good care. Thank you.